so you may be an MONW type. And we'll have T-shirts soon. The breast cancer risk of recurrence within 5 years was threefold greater in patients with the metabolic syndrome. In colorectal cancer, rates of tumor recurrence and liver mets were higher in patients with metabolic syndrome. And the causes are diet, excess total calories, excess refined carbohydrates, and an increase in foods with a high glycemic index and glycemic load. And of course, one can do another lecture on this issue entirely. And we hope, as we progress with this, developing this idea and educating people, we will have lectures on this and how people might alter their diet. I'll address it a little bit. Digestive incompetence, where there's impaired digestion of proteins and fats, increases blood sugar after your meal. Sedentary lifestyle, where there's decreased muscle mass. If you even just take a walk after you eat, a half hour to an hour after you eat, it lowers the postprandial, the blood after the meal blood sugar, because the muscles don't need insulin to take up that sugar. And so it really facilitates better blood sugar control. Stress, altered diurnal patterns of cortisol secretion, interrupted sleep patterns, and dysregulation of the hypothalamic pituitary axis, which I guess in the modern world some people would postulate we all have to one degree or another. Smoking increases the reactive oxygen species. You know, despite everything we know, there's still, what, 20% of our population still puffing away. Treatment effect. Side effects of adjuvant glucocorticoid medications, chemotherapy, may have some adverse effect on metabolic syndrome. Another thing I didn't speak of, you know, some of the medications we use to treat psychiatric illnesses, some of the antidepressants and atypical major tranquilizers can have an effect on weight gain and production of metabolic syndrome. And then certain nutrient deficiencies seem to have a suggestion. And trace minerals, I think, are, you know, something we don't pay enough attention to, but we're trying to learn how to do that well. And so again, the causative factors, the dietary practices, excess calorie intake, excess intake of refined carbohydrate, and then the excess intake of the foods that are too easy to assimilate. Pretty much anything in a wrapper. Or anything in a bottle with color. And digestive incompetence, we again spoke to a bit. This is really a rehash. And I think I'm not going to talk this thing all over again. The stress issue, though, is really so important. And, you know, there's an increased association with all-cause morbidity, mortality, and the use of sleeping aids, the prescription sleeping meds. And it gets me nervous then when I have people who I can't get off of that. And one of the things I'm trying to figure out is, well, what more could we do to do that? And it's so cyclic, because to some degree learning about, you know, dealing with the stress in one's life could be helpful, or more exercise could be helpful. But it's so difficult, because in people who have bad arthritis, or, you know, have a chronic pain syndrome or chronic fatigue, or even who have being treated for cancer, it's very hard for them to have the energy to exercise adequately, and their whole sleep-wake cycle gets disrupted. At any rate, we spoke to this. So toxic exposures and toxic burden, there'll be another whole lecture. But, you know, some of the things that are germane are even the cosmetics the women are putting on their face. Because the parabens and the estrogen mimetics have a long-term effect on their health. In a certain subgroup of women, may be sensitizers to their risk for cancer, or promote, make it more difficult for them to respond to therapy. And bisphenol A, as many know now, has what's called epigenetic effects. It's not an effect directly on the gene, but it's on the the messenger molecules that interpret the commands or the directions of the genome. And that is passed on from generation to generation. And it may be that, again, the issues are so complex. The sheer effect of obesity and how that affects, again, the epigenetics of the mom and is transmitted to the child, but also the toxic burden that's transmitted from generation to generation. And you take the cord blood of infants, again, I've talked about this in the past, and you look at you know, the hydrocarbon products in there, whether it's pesticides or PCBs, and it's surprisingly high. And you can make yourself nuts about this. My idea is to figure out how to sort of be prudent, don't make yourself crazy, and then support healthy detoxification. Because Bruce Ames, who's a very famous biochemist scientist from Berkeley, postulates that you get as many products that are conceivably toxic from the normative diet as we do from the environment. And we shouldn't totally freak out about this, but we should proceed prudently. The treatment effects we've spoken about, and the nutrient deficiencies we've spoken about. So here are some of the diet strategies that you could use. You could limit starchy carbohydrates to 1 to 3 servings per day. And as we've often said, a serving size would be a slice of whole grain bread, probably a large ice cream scoop, certainly no more than a cup of whole grain or brown rice, etc. But that's the serving size. A baked potato would be fine if you scoop out the inside. That's where the pure starch is. And the outer 2/3 of the potato has got more fiber and protein and less of that heavy starch. And so you can indulge in that way if you do, and still enjoy those foods. And you choose whole grains when you can. Some people think that in a subgroup of people, high gluten foods can be stressful to them. I think that's a function of individualizing, learning about the uniqueness of the individual before you made it a blanket issue.
There's no fats on that list.
We'll get there. And you aim for 1 gram of fiber per 50 to 60 kilocalories, which just means eating unrefined foods. You don't have to get crazy about it. The high glycemic index foods includes, red rice, pasta, potatoes, candy, soft drinks, pastries, and dairy desserts. But there's some stuff that you kind of like and think you should be able to indulge in that I guess you can't have as much as you like. Fruit juices aren't so great for us. I think you could do them if you water them down a bit. Dried fruits can be problematic, so small quantities are recommended. The rest of the stuff is self-evident, I think. And you'd like to avoid eating carbohydrate foods alone. Why? Because they're absorbed more quickly. And so your postprandial, the after eating blood sugar rises much more rapidly. So it challenges your body. Whereas if you combine it with protein and healthy fats, you would do better. And high caloric, the beverages with the high fructose corn syrup, apparently the big pharma, not the pharmacy companies, but the farm companies, want to relabel high fructose to something else because now it's got a bad name. So they want to, and you want to avoid eating late in the day and evening. Snacking reduces eating meal size. A study, Dr. Seller was talking about calorie restriction being potentially helpful. And it's very hard to be kind of miserable your whole life. And I hate to say this, but one of the great champions of this was a guy, God, I remembered his name and it just popped out of my mind. But he was a guy, Walford. He was a pathologist, and he was somehow involved in the experiments in the dome in Arizona.
Oh, yeah.
And when they ran out of food, he was watching everybody, and everyone seemed to be getting healthy. So he made a life effort at severely limiting his calories, reducing his body temperature, so he'd swim in cold water. I guess it would be okay to live a long time if it was enjoyable. And the great tragedy is, he died at in his 60s, I think, or early 70s from multiple myeloma.